I'd like to introduce you to our esteemed presenter today, Kevin Lynham. Kevin is with Capstone Services. He is president of the insurance services at Capstone. Capstone Services is a recognized five-star Medicare agent in San Diego, and he began his career as an insurance carrier in 2010. He works with all types of Medicare plans, including supplements, advantage plans, drug plans, dental, and vision coverage. Kevin has been helping hundreds of people with Medicare and wants to answer your questions and give you information to make a decision that is beneficial both financially and medically. And with that, Kevin, the floor is yours.
Great. Thanks, Will. Again, my name is Kevin Lynham with Capstone Services, and appreciate the opportunity to share today. I know Medicare is an important topic for many of us here on the call today, as this is the annual enrollment period, October 15th to December 7th. And it's a busy time for all of us, but hopefully this information is helpful. My goal today is to provide a recap on the different parts of Medicare, as well as go into a sample plan that's available with United Healthcare, so you can kind of know what's available. It may or may not be an appropriate plan for you, but at least it'll give you an idea of what's available in the marketplace today. Also, another hot button is Scripps network of doctors. So if anyone on the lines with Scripps Clinic or Coastal, that's a big thing as well to consider. I'm happy to answer some questions specifically for you. We'll leave at least 15 minutes, if not more, at the end for Q&A. So feel free, if you'd like, to add any questions in the chat box. We can answer those at the end. So let's get started. Some of you on the call may not be on Medicare, may be on Medicare in the next few years, or maybe you have been on Medicare for just a few years, or maybe longer than that. But I think getting a refresher on the different parts of Medicare can be very helpful. And so we'll just kind of go through this information. Also, we'll talk about the costs for Medicare Part A and B and what that's changed for 2024. And just hopefully this information is very helpful for you as we go. So beginning the presentation here. Let's see here. So to help you understand what is original Medicare, what Medicare covers and costs, what it doesn't cover, the gaps in coverage, and then Medicare Part D prescription drug coverage, and the ways for enrollment. So these are the things that we're going to go through today. Again, as a reminder, some of you may have been on Medicare for a lengthy period of time, and so understand that this is a seminar for all levels of familiarity with Medicare. Medicare is a federal health insurance program for eligible U.S. citizens and legal residents, funded in part by the taxes that you pay while you're working. Medicare is not a family health plan, Social Security, or Medicaid, or here in California, Medi-Cal. It's also not free. So the money that you've paid into Medicare for a period of your working years could provide you eligibility for Medicare benefits. So who can get Medicare? U.S. citizens and legal residents. You must also meet one of the following requirements. You must be over the age of 65 or older, either under the age of 65 with a qualifying condition, or any age with a diagnosis of end-stage renal disease or ALS. So this is the opportunity for you to go on Medicare. And I hadn't mentioned earlier, but I am a Medicare agent here in San Diego County, but I also am licensed in other states as well. And so if you're out of San Diego County, I could be available to you as well. So Medicare has 4 different parts, Part A, B, C, and D. Part A is hospital coverage. Part B is medical outpatient or doctor visits. Part C is combined managed plan. I always use the term combined for Part C. It combines Parts A, hospitals, Parts B, doctors, and Part D, drugs. So that's the simple way to understand a Part C plan, is that it combines all 3, and then Part D is prescription drug coverage. And I know prescription drug right now is a big hot button in San Diego County, well, across the country for the cost of medications. And so it's very important to make sure that you do have the lowest cost for your medications come December 7th, because that's the end of the annual enrollment period, setting you up for a good 2024. So parts A and B came about in 1965 with President Johnson. And then part C came about, President Clinton brought about the Medicare Advantage or Part C plans. And then Part D came about through the President Bush administration to help simplify prescription drugs. Medicare Part A covers hospitals. It covers 80% of the cost for hospitals. If you paid into Medicare at least 40 quarters or 10 years in your career, you're eligible for a zero cost monthly premium for Medicare Part A. If you haven't, then there'd be a sliding scale based upon the number of quarters that you've worked. You can always reach out to your local Social Security office in town to help determine if you have a cost or what the cost would be for Medicare Part A. Part A covers hospital rooms, meals, intensive care, drugs and medical supplies, lab tests, x-rays, operating rooms, skilled nursing, some blood transfusions, hospice care, rehabilitative centers, services. And so these are the things that would constitute coverage at 80% for hospitals. Again, if you have any questions about any of these specific things, feel free to add them to the chat box, and I'm happy to answer those at the end. Medicare Part B covers outpatient, or it covers doctor visits, annual wellness visits, and preventative services like flu shots, lab services, blood and urine tests, CT scans, MRIs, EKGs, some health programs like smoking cessation and obesity counseling, physical, occupational, and speech therapy, diabetes screenings, mental health, durable medical equipment, ambulatory service center, ambulance and emergency room services, and some skilled nursing care. This presentation will also be available to you as well. If you'd like this provided via email, it can be sent over to you as well. So the cost for Medicare Part B. So on the left column, I see here, the premiums for 2024 are based upon your modified adjusted gross income for 2022. So it's always 2 years in arrear. So the IRS collaborates with Medicare to help determine your Medicare Part B premium. So again, Part B covers doctor visits and such. So if you file your taxes individually, you'll see on the left column, anywhere from 0 to 103,000, your modified adjusted gross income for 2022 will present your Part B premium for 2024. And you'll see that is over on the right column. It's $174.70 a month. These figures were just announced about 3 or 4 weeks ago. So hot off the press. Anywhere from 103,000 to 129,000 modified adjusted gross income for 2022. Your Part B premium over on the right column would be $244.60 a month. If you file your taxes jointly, then anywhere between $0 and $206,000 for your modified adjusted gross income from 2 years prior, your premium would be $174.70, and kind of down the chart there. So if you like, feel free, you can take a picture of this chart, or we can provide you the presentation via email. So I'll leave this slide up for just a moment because I know this is critical for many of us. The Part B premium, base premium for those for 2023 was $164 a month. So it has gone up $10 a month. The reason why the premium is higher for Part B is because there's what's called IRMA, which is a higher income earner adjustment amount. And so those that make more money 2 years prior will have a higher Part B premium. So just wanted to create some clarity as to what the Part B premiums will be for next year. The only way around paying the $174.70 per month is if you're on Medi-Cal. If you're on Medi-Cal, Medi-Cal pays the Medicare Part B premium. So what does Medicare not cover? Medicare doesn't cover all the out-of-pocket costs such as deductibles, co-insurance for Medicare Part A for hospitals, deductible and 20% of Part B costs, prescription drugs, routine dental, vision, or hearing, eyeglasses, contacts, hearing aids, care received outside of the U.S. except for certain circumstances, excess charges, and then also long-term or custodial care. So I want to focus briefly on the last one there, long-term or custodial care. It's really important to communicate to you that where long-term or where health insurance ends, long-term care begins. So there may be folks on the line that maybe are a caregiver or have been a caregiver in the past. It's important to communicate that Medicare will not cover the activities of daily living, such as bathing, eating, dressing, and those type of things. So please note that that is not covered by your health insurance. So these are all features that the dental, vision, hearing, glasses, etc., are not included under original Medicare's Parts A and B. So there are three ways for the original coverage to cover the gaps. So you have option one, which is a Medicare supplement or Medicare insurance, or Medigap insurance rather. Option two is a Medicare Advantage or Part C plan that I mentioned earlier. When I mentioned combine is C, combines A, hospitals, B, doctors, and D, drugs. And then the third option is employer group retirement plan through the state, through the federal plan, or through a former employer plan. As far as that's the third option. I'm able to help with the first two. The third one, I wouldn't be able to, but I could provide assistance and guidance to make sure that you do have the best employer plan as well. So Medicare supplements cover, Medicare supplements help to pay the out-of-pocket costs that come with Medicare Parts A and B. As I mentioned earlier, Part A covers 80% of hospitals and Part B covers 80% of doctors. And so where the Medicare supplement is an option for you to cover that 20% difference. So there are 10 plans all the way A to N. The most notable plans in San Diego County are Plan G or Plan N. Typically, some of you on the call may have a Plan F. Those are the most familiar plans. There are some others. There's our L's and A's here and there, but the freedom that this plan offers that any doctor who accepts original Medicare, you can self-refer yourself to that doctor as long as they accept Medicare. So there's an opportunity for flexibility that this plan has, but you do pay a premium for that. So on average, the premium at 65, you'd pay about $130 a month, give or take. As you get to age 70, it's closer to about $190 a month. And then when you get to 75, it gets closer to like $250 a month. Age 80, it's closer to like around $330, $340 a month, depending on the company. And then age 85, maybe closer to $370 to $430 a month. So that's just kind of an average for the Medicare supplements. So a Plan G, as noted, is one of the most common plans right now. Plan F is, you'll see on this slide, the differences between a Plan F and a G. There's only one box that isn't marked on a Plan G compared to a Plan F. It's the Part B deductible. So the Part B deductible for 2024 is $240. So you can see it over here. If you can see my cursor, Part B deductible is $240. Okay. Everything, and that's right here. That's the only box that's unchecked. Everything else is checked. So the Plan F was the Cadillac plan. You would have had to have your Medicare turned on by January 1st, 2020 to be able to have access to a Plan F. Plan G is the best alternative. The only out-of-pocket cost on a Plan G, again, is the Part B deductible for doctors. It's $240. Okay. So you'll see over here on a Plan N, there's another box that isn't checked. That's for like office copays, usually $20 or so. So that's the main difference. A Plan N will be mostly less expensive than a G, but it's important to compare. Some of you on the call may have a Plan F. If you have a Plan F, there's always an opportunity to lower your cost by going to a Plan G or possibly a Plan N. So please note that. So if your Medicare supplement is becoming cost prohibitive, then that is an alternative that you have. So basically what you'll see is a plan G can be anywhere from 190 a month and up, plan F 240 a month and up. As mentioned, it's all based upon your age. So what you'll see here is you would have a Medicare Part A and B card. Some of you on the call today do have a red, white, and blue card. That's a Medicare card. Along with that, you could secure a Medicare supplement plan, and then also a Part D drug plan. So we'll go into the Part D coverage here in just a moment. But this is the structure. You'd have 3 cards: Part A and B card, Medicare supplement card, and Part D drug card. Medicare Part C is managed care through a certain network of doctors. There's a particular plan in San Diego County some of you may have. It's within the Scripps network of doctors, Scripps Clinic or Coastal. There was a big change coming up here in January for that. 32,000 people are being rerouted to another network of doctors. If you were on a Medicare Advantage HMO plan with Scripps Clinic or Coastal, you may need to be making a change. So these are the additional benefits that's included on Medicare Advantage. You have dental exams, cleanings, x-rays, eye exams, glasses, contact lenses, hearing tests, hearing aids, wellness programs, and gym memberships, and Part D drug coverage usually is included in the Medicare Advantage plans as well. There's typically an annual out-of-pocket maximum on the Medicare Advantage plan, so it's very important to look closely at what that is. I think the biggest thing is our lives are very busy, but I think the biggest thing is periodically check your schedule of benefits page or explanation of benefits throughout the year, so that if you do have a big emergency, such as a hospitalization, or if you had to go to skilled nursing, you'll have an understanding of what your costs will be. So that would just be one encouragement that I would have for you. The Medicare Advantage costs, usually the premium in San Diego County are anywhere from $0 a month and up, depending on the style of plan. There are alternate options with Medicare Advantage plans that aren't HMO plans. There's also PPO plans, which does provide an out-of-network option to you as well. And so it's very important to look closely to see if that style of plan would be a good fit for you. And if so, just want to make sure that your doctors will accept that plan for 2024. The deductibles usually are $0. The drug deductibles are anywhere from $0 to $505, depending on the tier levels of your medications. Co-insurance co-pays can be as low as $0. They go up accordingly. And then prescriptions can vary, again, depending on the tier levels, tier 1 through 5. And so some of you on the call may be concerned about the cost of your medications rising, or things like the donut hole or the coverage gap. And I'm going to talk about that as well, just so that there's a proper understanding that based upon your medications, there could be a higher cost throughout the year if you were to go into that level. The third is an employee retired benefits. That could be through your employer or through the state or through the federal plan. I can take a look at that as well, but it's important to make sure that you're not paying extra premiums per month that are unnecessary. I find in this plan, sometimes there are unnecessary costs associated versus being able to go direct to a specific network of doctors and have a plan. So it's very important just to compare one plan to your plan and make sure that you still have the best and lowest cost plan based upon your medical needs. Medicare Part D prescription drug plans. You'll see on the left column, it covers certain prescription drugs based on guidelines set by the federal government. Each plan decides which drugs to cover. And in turn, on the right side, you'll see the formulary tiers, tier 1 through 5. Tier 1 is a preferred generic medication. Tier 2 is a generic. Tier 3 is a specialty medication. Tier 4 and 5 are brand name specialty medications. And so it does get more costly when you have higher tier level medications. So it's very important to also know that and have a clear understanding of what your medications are. You wouldn't want to sign up for something if you don't know for sure what you should expect your medications to cost come January. You'll see right here, there are preferred pharmacies in-network. There's in-network standard pharmacies, and then also out-of-network. So an example would be this. Maybe you have a medication that in-network you pay $0 for, maybe a generic medication. Out-of-network, maybe you pay $5. Or sorry, in-network standard, you pay $5. Out-of-network, you pay $20. So that's kind of how that works. You also want to make sure whichever drug plan you have, whether it's a standalone drug plan or whether it's combined with the Medicare Advantage plan, that you know which pharmacies are going to be the best for you and the lowest cost for you. So standalone drug plans can be anywhere from $4 a month and up, bundled with a Part C drug plan, usually $0 and up. There are deductibles involved that you should be aware of, and then prescriptions vary again depending on the tier levels that you might have. So your deductible, say it's $505 for the calendar year. You'll see that the plan, you pay the full $505 up front. Then through the initial coverage up to the $5,030, the plan pays the majority, and you pay a percentage of that based upon the tier level of the medication. Once you go into the coverage gap, you also have heard this as the donut hole. Anywhere the costs incurred between $5,030 for next year and $8,000 that you and the insurance company pay, you go into the coverage gap. That's where you pay 25% of the cost of the medication. So I think it's very important to communicate that maybe the months January through June, maybe your medications cost $40 a month, but maybe in July through October, your medications could jump to $400 a month. Okay. It's really important to communicate that to you. And then maybe in November, December, maybe you're in the catastrophic phase, the insurance plan covers 90% and you pay 5%. So it's very important to note that just because your medications are at a certain level come January doesn't mean in July it's going to be the same cost. So please be mindful of that, and on your current plan, or if there's a new plan that you're looking at. As far as enrollment goes, there are different enrollment periods when you can sign up. You can sign up at age 65 if you're receiving Social Security or railroad benefit. That's an automatic enrollment. Or you can do a self-enrollment at 65 if you're within the first 3 months of your 65th birth month, your 65th birth month, or 3 months after your 65th birth month. It's called your IEP, Initial Enrollment Period. Okay, so this is your 7-month window. So there might be some folks on the call today that are 64. Maybe you're paying for health insurance and it's costing you $800 a month. In that situation, I imagine you probably can't wait to go on Medicare. And if that's the case, you could sign up 3 months before your birth month. So I'll give you an example. So say your 65th birth month is coming up in April of 2024. You can sign up in January of 2024 with a April 1st effective date. Or you can sign up in June of 2024 with a July 1st effective date. Some of you may work until your 65th birth month and retire the month after you turn 65. And in that situation, you can sign up anywhere in here so that your Medicare will begin May 1st. So this is just some examples of what you'll see. So these are a couple more common examples. So we have Mary and we have Bill. Mary decides to leave her employer coverage and Bill continues his employer coverage. Mary turns 65 in April. She enrolls in Medicare Parts A and B. She chooses a health plan and a drug plan. Bill turns 65 in April. He only enrolls in Medicare Part A for hospitals. He delays Part B for doctors. He continues his employer coverage as long as it's credible. He leaves at age 67 his group plan. He enrolls in Medicare Part B 60 days before he loses his group coverage. He chooses a health plan and a drug plan. So these are two examples. We've got Mary that leaves her employer group coverage. She's turning 65. bill continues over the age of 67. So I have a lot of questions. Again, if you have any questions, feel free to add the questions to the chat box, and I'm happy to answer them at the end. But if you're over the age of 65 and you're still working and you're on a group health plan, as long as it's credible, you will not incur a Medicare Part B penalty. So there are two forms that can be provided. The forms are CMS 40B. Again, that's CMS 40B. And then also CMS L564 or CMS L564. Those are two forms that you'll want to fill out when you decide to retire, that you'll want to provide your employer so that they'll fill out saying you've had credible health insurance since you turned 65 so that you don't incur a Medicare Part B penalty. So we are in the annual enrollment period right now. We're pretty much halfway through, October 15th to December 7th. So we have about 3 more weeks left. So if you've been wanting to make sure that you have the best plan, this is the opportunity that you have. This is your main opportunity in the calendar year to switch from a Medicare Advantage plan to a Medicare Supplement and prescription drug plan, or from a Medicare Advantage plan to another Medicare Advantage plan. And so this is the opportunity that we have for an annual coverage review. The plan changes do have an effective date of January 1st. The special enrollment period is due to moving, losing coverage, being set up with low income, also a plan leaving that's leaving the area, or other special situations like moving into a senior living community. So there are special enrollment period opportunities. If you decide to move out of your county to a different county anytime throughout the year, you would be awarded a special enrollment period. If you're losing group health insurance, either voluntarily or involuntarily, it's a special enrollment period. So if you're you don't have to only change during this window, but if you are losing your coverage or any of these other reasons, then you're able to make a change. So I work with several networks of doctors, including Sharp, Scripps, UCSD, local to San Diego. Again, for those that might be out of San Diego County, I work with, I can access networks as well. I work with United Healthcare, Anthem, Blue Shield, Humana, Scan, and Alignment. I can provide the new 2024 plan benefits for your insurance company with a network of doctors. This is a sample plan. This is within the United Healthcare, within the Sharp network of doctors. This plan also does have an out-of-network component. There may be folks on the call today that have United Healthcare and have Sharp Steely or Sharp Community Medical Group, and maybe you have the AARP Secure Horizons plan, or maybe the Premier plan, or Plan 4, or Secure Horizons, or Sharp Walgreens plan. This is the newest plan that just came out January 1st. So some of you may not know about it, but it's called, this plan is the 026P plan. It's a POS plan, point of service, and it's the point of service plan. And the plan premium is $0 per month. There's an in-network component to it. There's also an out-of-network component. The out-of-network component allows you a $30 opportunity for copay for a specialist outside of the Sharp network of doctors. The Medicare deductible is $0. The annual out-of-pocket maximum is $2,900 for the calendar year. Primary care and specialist office visits are $0 copays. Inpatient hospital is $200 copay per day, days 1 through 7. Important to note also, this particular plan is a 3.5-star rated plan. Days 0 copay beyond 8 and beyond. There's up to day 90. There's no copay. So the $260 per day copay counts towards the $2,900 out-of-pocket maximum. So skilled nursing, you do pay for days 21 to 100 at $203 a day. be mindful though that the maximum in the calendar year is 2,900. There are some folks also maybe on the line here that are working and want to make sure that they actually have the benefits available to them. So it's very important to look at your policy and see what your annual out-of-pocket maximum is. Sometimes they can be much higher than this, in some cases lower, but it's very helpful to look at it and make sure. Again, this is just a sample plan, possibly not the right plan for you. It's important to communicate to you that I'm unable to work with Kaiser in San Diego County. They keep everything in-house and they work with inside agents. So I just wanted to bring that to your awareness as well. Lab services or blood work, you pay $5. X-rays, you pay $10. Emergency care, you pay $75. And then urgent care, you pay $30. Routine physicals is zero copay. Eye exam, zero. Routine eyewear, you get $300 every year towards glasses, contacts and frames and lenses. $1,000 worth of combined preventative and comprehensive dental. Hearing aids, discounted hearing aids are included anywhere from $99 to $1,249 copay per hearing aid. If anyone here is utilizing hearing aids, you know that hearing aids can cost several $1,000s per aid. So this is a huge benefit to have heavily discounted hearing aids. Chiropractic and acupuncture is included. 12 zero copay chiropractic and 0-12 copay acupuncture sessions per year are included within a network of chiropractic and acupunctures in San Diego County. OTC is over the counter. It awards $50 per quarter for over the counter items. This particular plan has a scanner, a barcode on the back of the health card. The health card is called the U card. It's an analogy for United Healthcare card, and it's quite helpful. It gives you the health card, the pharmacy card, as well as the barcode on the back that you could use for over-the-counter items. It's a third option. The first two options were ordering over-the-counter benefits online or over the phone. This is a new feature where you can go into a pharmacy, and if you go into the over-the-counter section, and you can get toothbrush, toothpaste, Neosporin, Band-Aids, ibuprofen, vitamin C packs, and vitamins and supplements and those type of things per quarter. It's $50 per quarter. It also provides meals post-surgery. The group is called Mom's Meals, and they'll mail you the meals similar to HelloFresh via the mail, post-surgery or post-skilled nursing care needs. Medications, tier 1 and 2, zero copays for preferred generics and generic medications. Tier 3 medications is $45 copay. Tier 4 medications, $100 copay. And tier 5 is 33% coinsurance. So what you'll find with most of these similar style plans, the Medicare Advantage Part C plans, is that tier 3, 4, and 5 have a close cost from plan to plan. If you're currently with United Healthcare and you're paying for medication costs at $4 or $10 per medication per month, you might want to consider a plan that has $0 copays. This plan also does offer coverage through OptumRx, and it's the mail order house for United Healthcare, where you can get your medications through the mail as well. This is my information right here. If you need me or have any questions, it looks like we have 6 chats and 3 Q&As. If anyone else has any Q&As right now, I'm happy to answer those for you, just to simplify that, make it easy for you. Whether you have questions about SHARP or scripts or Medicare Advantage plans or HMO or PPO or drug plans, the floor is yours. We have 20 plus minutes right now to make sure that you get all of your questions answered right now.
Yeah, thank you, Kevin. And now is the time to ask that question. We have Kevin here. Happy to answer any questions. We do have some questions in the Q&A. If you're ready, Kevin, we can go ahead and get started.
Sure.
First question is, I have A and B. How do I get Part D?
How do you get Part D?
Yes.
An agent can help you sign up for Part D through the Medicare.gov website. or you can sign up for Part D on your own if you like. You can go to Medicare.gov. You select a new plan for 2024. You enter your medications, your zip code, and you can pull down the drop-down bar for lowest cost medications and premiums, and then it'll provide you a list of your the best plans available for you. You can also check star ratings on the plans, up to 5 stars. Most drug plans don't have a 5-star, and very few have a 4-star, just in full disclosure to you. So you can have an agent such as myself help you sign up for a Part D drug plan, or you can sign up for yourself on the Medicare.gov website.
Excellent. Excellent. Another question is in regards to Advantage plans. What's your thought on Advantage plans?
So Medicare Advantage plans serve a purpose. I would say for me, about 75% of my clients have Medicare Advantage plans. About 25% have a Medicare supplement. Medicare Advantage plans, if you are familiar with that style of plan and you understand that you need to get a referral from a primary doctor to see a specialist, if you're okay with that, and you understand that there are oftentimes prior authorizations, et cetera, with surgeries and things like that, there has to be an approval on them. It could be, a few more hoops that you have to jump through, but many of the Advantage plans have a 0 monthly premium, such as the sample plan that I shared this evening. And so hopefully that answers your question, but if you're familiar with that plan and you understand that it could take a little bit longer to see a specialist, because in many cases you have to go through your primary doctor. And if you're okay with that, for that, the cost benefit, paying 0 per month, then you could do that. Personally, my parents have a Medicare Advantage plan. It's worked out fine for them, and they do live here in San Diego County.
Perfect. Another question. I understand the cost for a supplemental plan varies by your age. Does the cost for a supplemental plan also vary based on health conditions?
So the only differentiation on cost for Medicare supplements, if you use tobacco. So I have 2 different pricing grids for tobacco use and non-tobacco use. So it's pretty easy, once I get that question answered, to be able to quote you an accurate cost with several companies for the cost of like a Plan G Medicare supplement or a Plan N, or if you already have like a Plan F, I can provide that for you based upon if you're a tobacco user or not.
Mm-hmm. Perfect. Military question. For retired military, is TRICARE for life still the best Medicare support plan?
So for many years, I've said that TRICARE is something that I would not change somebody off of. So as long as your benefit structure is still as it has been, which is where you can go to any doctor and utilize your TRICARE. I've heard recently with TRICARE that you have to go through your primary doctor first to get a referral to see your specialist, but that has not always been the case. And so TRICARE is great coverage. It's typically worked as a Medicare supplement style plan where you can go anywhere. And again, you'd want to look at your benefits, but usually you don't pay a monthly premium for that. So I don't want to speculate, but TRICARE is great coverage, and it has been. But if you want to ask specifics, feel free to reach out to me, and I can give you some specifics based upon what you have.
Perfect. Thank you. Another question. Do I need a prior authorization with an Advantage PPO?
So for a Advantage PPO plan, so in my experience, the Advantage PPO plans are newer to the marketplace, but they would require a prior authorization internally. The PPO Medicare Advantage plans give you access outside of a specific network like Sharp or Scripps, but I believe you still have to have prior authorization.
Perfect. Is PACE for long is PACE for long-term care included if you have Medicare?
I know PACE has their own Medicare Advantage plan. In my experience, can you read that question again, Will, please?
Sure. Absolutely. It is PACE for long-term care included if you have Medicare? Or LTC? He said LTC is the acronym they used.
So if you're referring to PACE as an adult daycare, and if you meet the criteria of your policy, whether it's 2 or 3 of the activities of daily living, or in some cases, 2 or 3 of the 7 activities of daily living as written, on policies 20 plus years ago, then, and if you meet the criteria of your policy, then I believe you would be eligible for utilizing it for adult daycare at PACE.
Perfect, thank you. There's a message regarding health savings accounts. A attendee wanted to make sure that you note that if you're working and paying into a health savings account, do not enroll in Part A until you plan to stop working or retire.
Correct. Six
They
months. You
come-
got to wait. You don't want to pay into the health savings account within 6 months of retiring. You want to hold off from that.
Okay. Another question. I'm still working at 66 and have not enrolled, but I have my group insurance. I will be retiring at 67. Will I be penalized?
No, as mentioned, as long as you have those 2 forms filled out, the CMS 40B form and CMS L564, upon retirement, within 2 months of coming off group health insurance, those 2 forms would be provided to the national Medicare. You can fax those to the national Medicare number, or fax to your local Social Security office, or bring them into your local Social Security office, and then they'll turn on your Medicare Part B. For if at 66, if you haven't yet turned on your Medicare Part A, again, which is for hospitals, you'll want to make sure that you do that too. So some of you on the call may have already signed up for Part A, but not B. And some of you are over the age of 65 and haven't signed up for Part A yet. So it's just really important to know that you have to kind of put all the puzzle together with all the pieces. And when you do decide to come off group health insurance, not only do you want to provide your employer those 2 forms to fill out on your behalf, so that you can turn those into the Social Security office, so that you do not incur a Part B penalty. And if you haven't already signed up for Part A, you'll want to sign up for Part A as well.
Great, thank you. We had a viewer that missed the first part and wanted to ask about the cost of Part A if you're 65. Do you have any information on that?
So if you paid into Medicare at least 40 years or 40 quarters in your life, or 10 years, then you're eligible at a 0 premium Medicare Part A. If you haven't paid 40 quarters, then and if you already have Part A, you probably would receive a notice that says how many quarters that you have, and in turn, how much your Part A premium would be. You can always contact the local Social Security office and ask them how many quarters you have.
Perfect, thank you. Another question. I had Sharp when I lived in San Diego. I now live in Sun City. I cannot find a reputable network at Sharp. Could you refer one in my area?
So if you're referring to Sun City, California.
Correct.
So I believe that's Riverside County. I think so. I would recommend reaching out to me directly, and I can look up some doctors that are accepting new patients and provide you some assistance. There's always the opportunity at a cost to purchase a supplemental policy for access to any doctor nationwide that accepts Medicare, but we would want to talk probably offline, and I can get you some network of doctors that might work for you.
Perfect. Is United Healthcare Plan a PPO?
This particular United Healthcare plan that I shared today was an HMO. Also has a POS notation, which stands for point of service. It does offer a second opinion outside of the Sharp network of doctors. On this particular plan, I wouldn't encourage you to have a procedure or surgery outside of Sharp, simply because the MOOP, or the maximum out of pocket, is $10,000 per year, as opposed to the $2,900 out of pocket for within network. But it does award you a second opinion for $30 with a specialist, no referral required. So this particular United Healthcare plan is not a PPO plan. There is an alternate option that's available, a new plan with United Healthcare. That's a Medicare Advantage PPO plan that, if you'd like, I can get you the information on.
Great, thank you. Scripps Coastal question. You mentioned that Scripps Coastal is not accepting Medicare Advantage. Are they accepting regular Medicare?
They are accepting regular Medicare. It's encouraged, as one of my slides alluded to secure a Medicare supplement, or like a PPO style plan, where you would have that 20% difference covered. If you went just straight to original Medicare Parts A and B, that you're covered at 80% of the cost, but you could be subject to that 20% cost if you don't have a supplement. So you can go original Medicare to Scripps. Based upon the changes that have occurred as of January 1st, you wouldn't be able to utilize an HMO style Medicare Advantage plan with Scripps Clinic and Coastal.
Okay. Another question. If I started with Advantage, can I switch back to Medigap?
So this is the window of opportunity. So Medigap plans are not always guaranteed issue. We do have at least one company right now that is offering guaranteed issue. So if you do have a Medicare Advantage plan right now, and you want to switch to a Medicare supplement and a standalone Part D prescription drug plan, this is your opportunity to do that. But to answer your question, there's not always a guaranteed issue, meaning no medical underwriting. Like most of the year, you would be required to be fully medically underwritten to determine if you're eligible for a Medicare supplement. So this is an actual signed, sealed, delivered, stamped approval to get that right now. So if you're unhappy with your Medicare Advantage plan, or if you're with Scripps, or one of those situations, then this is the opportunity to transition onto a Medicare supplement and a prescription drug plan. But there's no guarantee that in the future that will continue. Offline, I can share with you the particular company that is extending that. Yeah, so.
Terrific, thank you. Another question. Medicare premium is based on MAGI, which I'm assuming is modified adjusted gross income, for prior 2 years. I just retired in August and will be 65 years old in March, so we'll need to sign up for Medicare. My income has dropped by 75%. Will I still pay the higher premium based on my previous employment income?
So two thoughts. The first would be yes. Beginning March of 2024, your Part B premium, as well as your Part D premium. So I don't have it on the slideshow, but there's also an adjusted IRMA for higher income earners for Part D as well. But yes, it would be, but there's a form. Feel free to write down this number. It's an SSA 44. It's 8 pages. The first 2 pages are the pertinent pages. The last 6 are or how to fill out the form, but it's called an SSA 44, and it awards you the ability to check a box that says work stoppage. And in many cases, I've had people helped people to significantly lower their Part B premium for both them and their spouse. And so that is a form you'll want to look into. I have that form. If you want to give me a call, I can email it over to you. It's an SSA 44 form, and it can be very helpful.
Premium for Medicare B is $164.90. What income causes the premium to increase?
So if I was to go to my slide, right, can you see the slide?
Yes.
Okay, just a sec. Sorry about that. All right, everyone, close your eyes. All right, so it's IRMA, it's higher income earner adjustment amount. Yeah, so here it is. So if you file your taxes individually and they're below, from 2 years ago, your modified adjusted gross income, it's under 103,000, you pay $174.70 a month. Let's go down to the bottom. If your income's over $500,000 as an individual, then you would pay $594 per month. So it's the cost associated for being a higher income earner, and that's how the structure of how Medicare Part B is. If you file your taxes jointly, it gives you the 103,000 times 2. So anything under 206,000 would create a Part B premium at $174.70 per month. And so hopefully that answers your question.
Thanks, Kevin. Well, hopefully everybody there was a lot of great information there, and there's a lot of good information you can use. If you want to get in touch with Kevin, he'll put his information on the screen. Feel free to contact him for any questions. It is open enrollment, but it will be ending, so you want to get those questions into Kevin as soon as you can. Hope you learned something new and beneficial today that you can put into use. Feel free to reach out to Kevin if you have any questions. We want to thank you for joining us this afternoon, and we hope you enjoy the rest of your day. Thank you for taking the time out, and have a great day.